How's it going, everyone? I'm Dr. Brian Vear at Binger Chiropractic here in Huntley, Illinois. And today we're going to be talking about carpal tunnel syndrome. Specifically, what does it present as and how do we treat it here at Binger Chiropractic? So, carpal tunnel syndrome is when you have compression of the carpal tunnel, which is the tunnel where what's called the median nerve goes into your hand and innervates your hand. So you can get a compression on the carpal tunnel many different ways. One of the most common ways you get compression is putting your hands on a keyboard where you're typing right here. That pressure downward over an extended period of time can compress the carpal tunnel, giving you hand pain. Now, a lot of times carpal tunnel syndrome will show up overnight because research suggests that hand volume actually increases from 8 a.m. to 8 p.m. So while you're sleeping, if the volume of the hand increases and you have compression on that carpal tunnel, then that causes pain that experiences typically at night. Most of the time you'll feel it in the dominant hand, but occasionally you can feel it in both hands, such as typing on a keyboard. Now, most of the time as well, it happens in women rather than men, because a lot of women will do different tasks that are very repetitive, and that can put a lot of compression here, kneading, sewing, different things that compress the carpal tunnel down. So what do we do here to help alleviate that pain? So the first thing I'm going to do is check out the carpal tunnel, and I'm going to palpate around the joint to see what's moving and what isn't moving. You can take a test by tapping the carpal tunnel, and if it reproduces pain down the hand, then that's a sign that there could be entrapment within this nerve. So what we do is we kind of gap the hand and roll it out like this. This stretches the tissue and kind of breaks up the scar tissue around the carpal tunnel, freeing up the median nerve. If that alone doesn't work, then we can take the joint and we can adjust. And by adjusting the joint, it gets a little bit more mobility and frees up the nerve. And lastly, in order to break down some scar tissue in the carpal tunnel, we take a Graston technique. A little bit of lotion and a tool to kind of scrape out and break down the surrounding fascia around the carpal tunnel. Research suggests that you should try conservative care first before opting for surgery, because surgery and conservative care have roughly the same amount of success rate. So if that interests you, if you're suffering from carpal tunnel syndrome, or if you have those night pains or hand pains that you're dealing with, give us a call, make an appointment today, and we can get you sorted.